Assalamu alaikum. We will continue with the neuroanatomy and cranial nerves. Today we'll start with the abducent nerve. Abducent nerve is abducent or abducens nerve. It is the sixth cranial nerve. By the end of this lecture, you will be able to know why this is called abducent nerve, location of its nucleus, connections of the nucleus, its course, functions, and its lesions. Why this is called so? Abducens, basically it is a Latin word which means leading away. As this nerve leads from the brainstem and supplies the lateral rectus muscle. There is abbreviation to memorize it, that is L6. L6 denotes lateral rectus, that is supplied by the sixth cranial nerve. This is the summary of the nerve. This is purely motor nerve and it supplies the lateral rectus muscle, so it helps the eyeball to move laterally in anatomical position. It arises from the hindbrain between the pons and medulla, and it enters into the orbit by way of superior orbital fissure. Here it is a short summary of the abducent nerve. You can appreciate the nucleus of abducent nerve that is present in the lower part of the pons in the brainstem. From here the nerve courses forwards. It enters into the Dorello's canal and it enters into the cavernous sinus, from where it enters into the superior orbital fissure and supplies the lateral rectus muscle. Abducent nucleus is the motor nucleus. This nerve is purely somatic motor. The nucleus is located in the lower part of the pons and supplies the lateral rectus muscle. Connections of the abducent nerve nucleus. It receives three types of connections. One are the corticonuclear fibers, other are the tectobulbar fibers, and the medial longitudinal fasciculus. This slide shows different connections of the abducent nucleus. Please find the abducent nucleus that is present on both sides of the midline, just anterior to the floor of the fourth ventricle, beneath the facial colliculus. Here you can see the cerebral cortex, from where the corticonuclear fibers they reach the abducent nucleus from both cerebral cortices, both cerebral hemispheres, and find the tectobulbar fibers. They reach the abducent nucleus from the superior colliculus. Then you can also see here fibers of the medial longitudinal fasciculus. By these fibers, this nucleus is connected to the third, fourth, and eighth cranial nerve. Now we come to the pathway of the abducent nerve. Pathway starts as the nerve emerges from between the pons and pyramid of the medulla. Here you can appreciate the fibers of the abducens nerve that arises from between the pons and the medulla. At the base of the brain you can see the abducens nerve present at the junction of pons and medulla. Next, the nerve enters into the Dorello's canal that is present at the junction of inferior petrosal sinus at the apex of the petrous temporal bone. Here you can look, locate the abducent nerve at the anterior surface of posterior cranial fossa. Here you can see an arrow that shows the location of the Dorello's canal that is present at the junction of inferior petrosal sinus and the clivus. From Dorello's canal, again you can see here the Dorello's canal and the presence of the abducens nerve in it. From this canal, the abducens nerve enter into the cavernous sinus. Unlike trochlear nerve, the abducens nerve is present in the middle of the cavernous sinus, very close to the internal carotid artery. From the cavernous sinus, it enters into the superior orbital fissure from its middle part to go into the orbital cavity. Here, in this slide, you can see the abducens nerve that is highlighted. It starts from the brainstem, then it goes forward into the Dorello's canal. You can see it entering into the center of the cavernous sinus. Then you can appreciate it entering into the orbit by way of middle part of superior orbital fissure. Then it reaches in the orbital cavity. Here the abducens nerve, it reaches the orbital cavity by passing through the middle part of the superior orbital fissure. And finally it supplies the lateral rectus muscle. Here is the total course or summary of the nerve. You can see its nucleus there, fibers of the abducens nerve leaving the brainstem, entering into the cavernous sinus, then they enter into the superior orbital fissure and they reach the orbital cavity to supply the lateral rectus muscle. It innervates the lateral rectus muscle of the ipsilateral orbit. It is responsible for the lateral gaze. This is the figure. You can see the direction of movement of the lateral rectus that is on the left side on your screens. That is, the eyeball will move laterally away from the midline. So, lateral rectus muscle is responsible for the abduction of the eyeball. Now we come to the lesions. Lesions of the abducens nerve, in case it gets damaged. There are two types of lesion that can be found in case of damage: medial strabismus and diplopia. The action of the medial rectus will be unopposed and in anatomical position when the patient or the subject is looking straight in anatomical position. The eyeball will move medially because The lateral rectus is paralyzed due to lesion or damage to the abducens nerve. Medial rectus will pull the eyeball medially towards the midline. Secondly, double VN will be found in patients having abducens nerve damage, that is known as diplopia. Thank you.